Hi, everyone. We're going to get started. I'm Patty Jean McCahill. I am the Development and Marketing Director here at Feeding America West Michigan, and we're excited for you to join us today in learning more about this exciting research presentation. We are going to start with just an attendance poll to see type of participants that we have. So if you can go ahead and fill that out, that'd be great. Well, it looks like we have a really good mix of people. The food bank staff is here to join us, and we're excited to have so many other agency partners and community partners, and we have some donors as well. So our presenters today, I am presenting the first couple sections, and then I am joined by a peer of ours at the food bank, Joseph Jones, who is the Director of Strategic Initiatives and Partnerships. We have 6 kind of modules to present to you today. After each of the modules, we'll have Q&A. So feel free to put the Q&A in or in the chat box or under Q&A. Our mission at Feeding America West Michigan is to gather and distribute food to relieve hunger and increase food insecurity in our West Michigan area and the Upper Peninsula. Our vision is a community in which all neighbors are nourished and empowered within an equitable food system. So we started in 1981 by a few Michiganders who believed no one should go hungry. And they began gathering surplus foods to distribute to people in Kent County. The first product that was gleaned was carrots. In 1983, we joined Feeding America. That is the national network of 200 food banks across the country. Different food banks go by different names. We adopted the Feeding America name in 2015. So the other thing is that 2021 marks our 40th year of nourishing neighbors together. So despite 4 name changes, our core beliefs have remained constant, that no one should go hungry, meals can change lives, and good food shouldn't be wasted. So we work in 40 of Michigan's 83 counties. Of those counties, 33 are rural and 7 are urban. We have our main distribution facility in Comstock Park, and then 2 other distribution facilities, one in Benton Harbor and one in Cadillac. And we also have some partner organizations throughout the state. Our agency partners are comprised of food pantries, congregate eating sites, schools, backpack programs, and community centers. In 2020, we actually had about 1,500 mobile food pantries that we distributed nutritious food. That's about 30 to 40 mobiles each week. And because of the pandemic in 2020, we moved to a drive-through model. But incredibly, we saw a 64% increase in mobile food pantry attendance. So we've never seen that in the history of the food bank. And we distributed about 29 million pounds of food, or 23.6 million meals. So I'm going to switch into the research itself. The study was intended to better understand people with lived experiences, understanding of client demographics, as well as perceived mobile food pantry program value, relevance, and also the impact on dietary behavior. And importantly, we use both qualitative and quantitative data collection methods. We actually, since this was such a large study, we partnered with a company called Public Policy Associates out of Lansing to do the data collection and analysis. So the survey was really, really robust. It was an online survey where 644 clients responded to it. We had 6 focus groups, and that was the qualitative. We had 34 clients participate in the 6 focus groups. And then we talked to 7 agency partners. What that large client base provided us was a representative sample. So when we report out on the data, we can say with high certainty that the data results are correct and projectable. We also had a representative sample of our entire service area, which was important, and we wanted to really honor the fact that our clients were spending time with us. And so we compensated them for their time for both the online survey and focus groups. So I'm going to be sharing a couple of stories of our clients, and these are really typical stories of what we see in terms of our neighbors in need. And Emily, who is a mom of 5, basically said that money is just really, really tight for her and her children, and that they've been playing catch up because of her husband's loss of income. But even before the pandemic, things were really tight for them. Emily quit her job when her last set of twins were born. And so because they went down to a one-income family, they saved on daycare costs, but found the money restrictions really tight. And they also were experiencing unpaid medical bills. So of the survey respondents, 75% were female, and the average age was 53. What we found was that 52% of clients have at least some children present under the age of 18. So on average, it was 2.1 children living in those households. Teresa is another one of our clients who actually attends the Cadillac Revival Mobile. Not only is she a senior on a fixed income who takes care of her mother, but she lives with her granddaughter and son-in-law, who both have hourly jobs. And so despite having income generated in the household, they just find it very difficult to make ends meet. And Teresa in particular finds that the mobile has a wide range of healthy options, which she's super appreciative of. So again, the composition of the people who finished the survey, 84% were white, and that really reflects the rurality of our service area. 5% were Black or African American, and 10% were of Hispanic or Latino origin. The story of Deborah is great because it really talks about the power of volunteers, and Joseph is going to talk about that in a little bit. But Deborah couldn't make the mobile at the time at New Hope Community Church. And so the volunteer coordinator, Sharita, really went the extra mile and waited for Deborah to arrive to give her the food. And she and her husband are both experiencing medical expenses that make it hard to make ends meet. So what we found was pretty staggering. 79% of the clients were food insecure. And what we found was that there weren't a whole lot of differences across the service area, except for the fact that there were urban and rural differences. And food insecurity in urban areas was slightly higher than rural clients. The majority of our clients live at or below the poverty level. But importantly, and we'll see this in another slide, 90% of households have some source of monthly income. And a staggering number of clients reported that they have some unpaid medical or hospital bills. Majority of people in terms of income are generating between $1,000 and $2,000 a month. So as we said earlier, more than 90% of households have some source of income. Over 1/3 are receiving Social Security or a pension. And I think it's important to note here that 39% of people that are coming to our mobile food pantry are employed, whether full-time or part-time, and only 12% are receiving unemployment. So clients make trade-offs between paying a bill or purchasing food, and they do it pretty regularly on a monthly basis and several times during the year. More than 50% of clients cited having to choose between paying for transportation or food at least once a year. So you can see the types of trade-offs that clients make between utilities, medical bills, and transportation are the drivers of trade-offs. So Ashley is a 10th grader, and just as a note, her favorite subject is geometry because she just happens to be really good at it. But she and her family attend a mobile food pantry in Carson City in Montcalm County. And what we found about Ashley's family is that they make too much money to qualify for SNAP, which is the Supplemental Nutrition Assistance Program, but not enough money to cover the bills. And this kind of in-between status is very, very common of people that utilize the mobile food pantry program. So what we do know is that over 2/3 of clients have one or more medical conditions that are related to diet. And the mobile food pantry with its product offering really helps improve the diet of our clients. The other thing to note is the high incidence of diabetes at 22%. That compares with 13% of adults age 18 years or older that have diabetes in the US. So The other thing to note is just the high prevalence of depression among clients, which is at 18%. So in terms of different types of support that people access, 27% of clients are reported that they receive SNAP. And we actually think that the SNAP percentage is low because because of the high rate of poverty and food insecurity that we're seeing. And in Michigan, the SNAP program is called Bridges. And that answer option to select Bridges as a support received was not part of the selection criteria on the survey. So we do think that 27% is a little bit low. But of the people, the focus group participants said that the SNAP benefits cover about 2 to 3 weeks worth of groceries. And other supports access were going to a food pantry, a food bank, or a church in the past 30 days. So people on average went 2.4 times. So clients use various strategies to get enough food to meet the needs of their household. The most common one in more than 6 in 10 clients was buying the cheapest food available regardless of nutritional value. And I think the product that comes to mind to me in terms of this category are ramen noodles. But you can see that people do a lot of different things to basically cope for their limited income and to make their SNAP benefits stretch further. They eat food past their expiration date. A lot of them, 54%, receive help from family or friends. So the good news is that most of the clients who weighed in on the accessibility of the mobile food pantry that they attend, and the mobiles appear to be not only convenient and accessible, but people have very few challenges with the mobile. The one thing that was noted was the time that it took to get through the food line. 21% said it took longer. So the other thing that we see quite regularly is that transportation is a barrier for many people. And lots of people talked about sharing rides or picking up food for their friends or family who could not get to the distribution themselves. Okay, that's it for my section, Molly. It looks like we have one question.
Yes, we do. Someone had asked, could you explain why those who are not classified as food insecure may need help with food?
Sure. I think the screening question was based on the USDA, the food insecurity question. So people can still be of limited income and not food insecure technically, but still need assistance. It's pretty prevalent if people have got competing bills that they just need some short-term assistance. Joseph, do you have anything to add?
Yeah, if I hit my mute button. I would say that, you're also looking at people who are in a position where they are marginally food secure. So given the nature of the questions from the Census Bureau that they put out, some people might end up choosing a category that would make them food secure, but not necessarily make them comfortable in that position. And I think additionally, there probably is some people that are coming that aren't food insecure. We don't place a lot of heavy emphasis on their proof of need. And so there likely is some people who are coming under that situation. However, all the data suggests that, this kind of approach to use of charitable food sources is really minor, and there's not really any significant fraud going on.
We have another question in the chat. It says, given the health challenges, why is there so much sugar and salt in products at the Mobile Food Pantry? I don't know if that's a question for Shay or Joseph.
I'm happy to answer a little bit of it, and then Joseph can elaborate on what I'm going to say. Part of it has to do with what the nature of our food sourcing processes are. And I do want to point out too, that a research study this robust, we've never conducted for the Mobile Food Pantry program. So one of our favorite things about this study and why we're so excited to talk about it is because it gives us an opportunity to make some of those changes now that we have data to support the changes we would like to make, including changes to the particular products that we can source. But the part of the sourcing process is that we're heavily reliant on the donations that we get. For example, one of the things that was requested a lot is citrus fruit. We know that people really want oranges. We know that they're really healthy and delicious and great, but financially we can't support that. We can't source them in a way that is financially feasible for the food bank. So we also have to rely on the donations from our vendors and donors that come in. And part of that has to do with what's available in the market. During the pandemic, it's been very difficult to get certain products. It's been nice to see an influx of proteins, an influx of milk and things like that. So it is somewhat of a balancing act. But Joseph, if you want to elaborate on that too, feel free.
I think one of the things that I would say is to kind of understand the history of where the Mobile Food Pantry program has gone over time. In its origins, the Mobile Food Pantry idea was about moving out donated perishable product in a prompt way. It makes more sense to give it out to somebody than to throw it out. And so what were those items that we were receiving at that time that were perishable? Yes, there was produce. Yes, there was items like that, but it was also, processed meats. It was, lots of bakery products, cakes and breads and things of this sort. It wasn't necessarily an issue of health that was at the origins of this process. And I would say that, in the last 5 to 8 years, there was a movement to kind of move away from just using it because it was available to using it because it was appropriate for the clients. And so I would say that you've seen a distinct move over the last several years to more produce, kind of a guarantee of there being more produce on the distributions. As Shay pointed out, the last several years, there's been a greater availability of dairy products, of meat and kind of alternative proteins. So this has led there to be more in the direction of healthier product, but at the same time, I would say that we've never truly gotten away from the breads and the cakes and some of the items that Peg is suggesting, like why are they so prevalent here? Those pieces are still there. Given the results of this study, I don't know how prevalent they're going to be as we start moving forward into the next stages of the program.
We have another question from Sarah. Is delivery of the food to help people who lack transportation always done through informal friend and family networks, or have official volunteer programs to help people pick up and distribute food been done in any locations?
It's really been, historically, it's been an informal network of friends and family. I'm not aware, and Shay may know, but I'm not aware of any official volunteer program. I know up in the UP, there are a couple of mobiles where they deliver product to shut-ins, but no no transportation program that I'm aware of.
And Patty Jean's right. As far as it being an official designated program, whether it be administered by the food bank or administered by a other local nonprofit or community partner agency, there isn't anything specific that's set up. It's more on a case-by-case basis. And a lot of those relationships, like what Patty Jean was talking about, are ones that kind of have grown organically in the communities where they see a need for it. The example I can think of that's a little bit more formalized is in Manistee, which is in the UP. They have a relationship, the community partner has a relationship with the local dial-a-ride bus transit, and also with the community education alternative ed school. So kids from the alternative ed school come to the mobile at the end and they pack boxes, and then the transit will deliver them to those folks who are shut in, who are seniors, and have them sign in the required paperwork and all of that. So those kind of relationships have been very successful. Joseph and I have been working recently to get more of those type of collaborative relationships going in different areas where we see there's a need, but it really is a gap to service that has been difficult. Transportation is a barrier for a lot of our clients. So it is something we need to look at more in depth.
And, Sarah, I'd like to add that one of the things that we've seen is that particular agency sites and their agency coordinators, it largely depends on how much they've solicited who these other folks are. Some places there's very little of that happens because it hasn't been communicated to the organization as a whole, whereas some other of our agency partners have essentially gone out and sought out populations that are homebound or populations that struggle to be able to attend a distribution that is happening maybe during the day while they're working. And so they're setting up things so that they're able to make that food available to them, even though they can't be physically present at the day and time of the distribution.
Hi, Jean, those are all the questions at this time.
Okay, thanks. Joseph, do you want to go ahead and start your portion?
Yes, Patty Jean, could you authorize me to share?
Okay, sorry. Why don't I just advance the slides for you?
Okay, we're on 28. Excellent, thank you. So this section is about the access to healthy food, which we've talked about a little bit already with the questions that we've had asked. When we start looking at what the clients had to say about this, I believe that there's a stereotype that's out there that suggests that, a lot of this population has insufficient education, insufficient knowledge about health, nutrition, food generally. The data here runs counter to that and runs counter to the idea that they don't want the healthy food, that they don't want the produce. The argument here was very much that they do understand the importance of healthy food and that they view these distributions as one of the main, if not only, way that they have access to such things. So it's going to be paramount for us to not only maintain, including the produce on the distributions, but also to try and maximize it and seek out the ways in which variety can be provided. And so when we look at data that comes out from this, it's rather extreme. So, the question about, am I interested in eating more fruits and vegetables? This is coming out at 90%. And that furthermore, the majority of folks that responded to the survey were suggesting that they got most or all of their fruits and vegetables from the mobile food pantries. So this is very indicative that people want to eat healthier, and that the mobile pantry itself is having a positive impact on that diet choice. This slide particularly is demonstrating the ways in which, there are very few people that are only eating out of, there are very few people who are getting an extensive amount of their produce from other sources, and that what they're getting on these distributions, they are consuming. The fruits and vegetables were some of the least likely to be wasted items on the distributions, as we'll see in some future slides. And that most people, are utilizing them or are distributing them kind of within their communities. And so furthermore, the people that are participating kind of overwhelmingly stated that this is causing them to eat more fruits and vegetables, that their attendance at the mobile food pantry, that the access that they're getting at the mobile food pantry is driving consumption within their households. And so over 90% say that they're eating more fruits and vegetables because of this event. And cost was a big part of this. And so on the next slide, it really kind of points to the ways in which the reasons that they're not eating more fruits and vegetables basically amount to an issue of cost. If they didn't have to spend as much on fruits and vegetables, they argue that they would eat more of them. It's well known that in a grocery store, the most kind of financially prudent options in terms of gaining a caloric intake are not the most healthy options. And we've built a food system that is designed around that. There's numerous people, including from what I notice on the attendees this call, lots of folks who are pushing back against this and are trying to alter that dynamic. But cost was a major part of it. Furthermore, a lot of the dissatisfaction that we had with the mobile food pantry program was about that there wasn't enough produce on the distribution. So it was not an issue of getting the materials that they didn't want. It was that they wanted more of the healthy options that were available to them. So in terms of increased consumption, really what the study found, both in the data and in the focus groups, is that the access to fruits and vegetables on the distributions were impacting consumption. People were eating more of it. They were eating it more frequently, in greater quantities, and that they would continue to do so across the entirety of the month if these types of foods were more available to them, whether that was through the mobile food pantry program or through some other sources. At this point, I'd like to open it for questions again, comments, concerns. So does anyone have anything they'd like to ask? Okay, seeing none, I'll keep going. So this gets at kind of the satisfaction with the program that people had. And kind of to start this, we have a set of kind of quotes that are from the clients themselves. This is a sampling of the quotes, but I would add that overwhelmingly the response was positive. As we'll see in some later slides, there was very little disapproval for what was going on, and the approval was connected to what the food was, how the program was run. They spoke glowingly of the volunteers and of the sites and how the work was done. We had very few complaints. And even if you account for the fact that if you have a bad experience somewhere, you're unlikely to return, just the sheer fact that a lot of people have the need might lead them to attend, even if they weren't thrilled with some of the aspects of the event. That doesn't seem to be the results that we have here. So, the statements that you see here in terms of these client quotes really speak to the breadth of the support for the program among the clients. So when you ask them about what products that they wanted the most, and it really demonstrated that they liked the products that were available, and the healthy options all ranked higher. So the fruits and vegetables, the various types of protein that are available, the dairy options all ranked very high. Dry goods, shelf-stable items, baked goods, items like that tended to rank much lower. You know, when you got into what those desired products were, any types of meats were heavily requested. Alternative protein sources, whether that's in the form of canned meats, beans from some places, peanut butters, other kinds of nuts. These were all requested items. Variety was a big part of what was requested. So we've given a sampling of what some of these fruits and vegetables were. The list runs quite long in terms of the different fruits and vegetables that were named that people would like to see. I think one of the things to point out with kind of that fruit and vegetable variety that they're requesting is it was not so much that they were requesting anything that was terribly exotic. It was just a broader selection of the things with which they were already familiar. Some of the statements around more shelf-stable product that were requested were really tied to things that were culturally specific. So items that are hard to source that would be common within certain cultural dynamics. That's oftentimes what was coming up under the shelf-stable items. And ultimately, really, the desired products were really tied to the notions of whole foods. Anything that was unprocessed, anything that they could then turn into other options for food, different types of meals that gave them a chance to create a greater variety. Those were the things that were kind of most desired. Then on kind of the flip side of it, I mean, as Patty Jean pointed out at the beginning, one of our long-standing goals has been to decrease the amount of waste in the system when it comes to food. And so we wanted to know what products were most likely to go to waste, to get thrown away when they went home. We were quite concerned that the numbers would be high for fruits and vegetables just because of the perishable nature that they have. Even the same for some of the dairy products. What the response was is that it was much heavier on the baked goods, that the breads and cakes and various other items like that they were getting, that these were most likely to be, maybe eaten once or twice, but that the volume of it was much too high, that this was something that oftentimes found its way to the trash. The fact that these are disfavored, there has been a vocal group that have suggested that these are highly craved items. We're not trying to keep people away from cake. They can have cake if they want it. I have cake when I want it. I'm not going to stop anybody else. But on the same token, it is suggestive that is not, they don't see the need to be able to get that type of product from this source. That they have that's something that they do have better access to when they want it. So these other items were more likely to be desired. And so so then there's the question of kind of what quality is the produce on these distributions. Some of this that is sourced through donation, it may be nearing the end of its shelf life. Are people finding that it looks good? Again, the satisfaction ratings are quite high kind of across the board in these different categories. And even where they're lower, they're not places that are unexpected, and that this kind of satisfaction with the amount of fruits and vegetables that they get, that dissatisfaction seems to be from we would like more, not that there are too many of these types of items on the distributions. These next two slides both point to kind of the client experience being very positive, that their overall experience is rated as good or very good for over 90%, 95%, and that even the ones that kind of fall into the other categories are not really terribly frustrated by the experience. that they're rating it neither good nor bad. And then in this next slide, it really kind of points to how the treatment that they're getting is very positive, that, very few people feel any kind of negativity in the experience. They're not being shamed in any way. They're not being abused. They're not being ridiculed. They're not being challenged in ways that sometimes we fear when we're dealing with charitable food populations, and kind of how they're being treated. So kudos to all of you out there who are running mobile food pantries. It appears you're doing phenomenal work. So ultimately, kind of, as we summarize this set of the client experience, they talk about how they're treated with kindness and respect. They talk about how they see the hard work that goes into it from all the different levels of people that are involved. That when they're welcomed and they're greeted warmly and that they're treated, humanely, all of these types of steps really reinforce their ability to access this food that they need. So one of the things that's been up for debate kind of within our organization, and I know Shay has talked to a variety of partners in the community about this, is, COVID-19 pushed us to a position where we had to move to drive-through distributions. That this was necessary for kind of public health. And so it wasn't necessarily an option. It was something that we chose to mandate across the entire service area. Now, drive-through mobile pantries aren't new. The Upper Peninsula has used them for a long time. Other sites have used them. But before this, it was most often a walk-up model, a model where the clients got to kind of talk to the volunteers and engage with them more directly. It gave the clients a certain amount of decision-making about what they wanted to carry off with them, because they got to kind of pick the food out rather than kind of being told, here's what you're going to get. There seemed to be kind of a split opinion of this among the people that were interviewed. And it seemed universal, both of the partner agencies and of the focus group members, that they could see the merits of both sides. They agreed, both agencies and clients, that the drive-through is safe, smooth, it's efficient. The process takes a shorter period of time when it's done that way. They found all of that to be very positive, but some of them very much missed that walk-up model of being able to interact and engage and kind of be able to pick exactly what they wanted off the tables. So I suspect, and I think that Shay would agree, that we've heard mixed responses from partner agencies about what they think is going to work best in their communities. And it very much appears that most of the agencies and clients have very good reasons for each of the models. I can see that when we reduce the COVID restrictions, I can see some agencies going back to the old model and some retaining the model that we've been using here currently. As for nutrition and health education, what we learned here is that very few of the agency partners are kind of independently providing health and nutrition education materials as part of the mobile food pantry experience. They're very much looking to the food bank to help to lead these efforts. We have utilized education materials, but it hasn't been universal to all distributions. So we are strategizing currently, some of the ways in which we can kind of expand the educational programming, make it available to the agencies to distribute, because again, a lot of the materials pointed to the ways in which clients trust the agencies they're going to. Oftentimes they've come to know these volunteers and these folks that are running these agencies. And so as a source of educational material, this seems to be a good option. In that same vein, clients themselves are having a very positive reaction. Go ahead to the next slide, Paige. That clients are having a very positive reaction to the educational materials that they have received historically. So 40% of the survey respondents said that they had received recipes, other nutrition education, taste tests at mobile food pantry sites. Now, obviously, most of that wasn't at the ones where they were being specifically interviewed here during the pandemic. A lot of this education materials, particularly taste testing and things like that, precedes the pandemic. But those clients who had some level of participation with it said that they found the information to be very good, easy to understand, that they were prone to sharing that information, that they were prone to using that information, and that it was providing them with information that they didn't have before. And so as such, it really kind of lines up with the idea that this is something that we can look to and expand a bit further. At this stage, does anyone have any questions? You guys are taking me back to my old professor days. I must just be doing a brilliant job because everybody understood everything I just said. So on that note, I guess we'll kind of look at kind of the overall lessons and kind of the pieces that we're drawing from the study and how it might apply to the program moving forward and information that we'll be kind of parsing out to our partners and to the communities. As Shay pointed out, as Patty Jean pointed out, this study really provides the first set of comprehensive data on clients across all the regions for this program. When you look at the Upper Peninsula, rural areas in the Northwest, urban areas in Southwest Michigan or around Kent County, Muskegon, Ottawa counties, rural areas in West Michigan, one of the key findings is that there wasn't a whole lot of difference in terms of the client response to the program. And this is pretty significant because it suggests that the program that we're running is being run kind of equitably across the regions, which I think is important. And it also suggests that the cultural differences that run across those regions, which are pretty significant, isn't necessarily creating any problems with how the program is being run. So the program itself is improving access to healthy food. The clients are the types of clients that we want to be reaching in terms of folks who would need this support either because of their food insecurity, because of their health conditions, because of their financial circumstances, and that it's providing kind of a critical source of need. A lot of the clients reported making some food procurement choices based around their knowledge of when mobile food pantries were going to occur in their communities. One of the concerns, as Patty Jean talked about before, is that the data suggests that less than a third of them have been signed up for SNAP benefits. And even when we take into account maybe some misunderstanding of the question, because the question only referred to SNAP or food stamps. If people see it through EBT, through the bridge cards, things of that sort, they might have misunderstood. I think it's pretty clear that they didn't misunderstand the level of 2 or 3 times what the number that was reported. And so there's probably going to be a need to expand SNAP education and SNAP awareness and access. In terms of the products, there's a clear interest on their side that we provide a variety of products within the core group of produce, protein, and dairy that we really try and target for these programs. Maybe more seasonal produce to be able to show the kinds of variety in fruits and vegetables. And that this emphasis on fruits and vegetables is kind of the core of a mobile food pantry distribution seems to be central to the work as well. A lot of our pantry partners would not be able to store the volume of fruits and vegetables that are going out through this type of program, the types of protein that are going out through this program. So it's not a competitive element with the fixed pantry sites. It's more of a supplement and a way that we're providing different foods. They're complementary. In terms of access to healthy foods, this is providing a discernible source for fresh fruits and vegetables. It's it's driving eating habits among this community and driving them in ways that not only do we feel are positive because of the health outcomes of eating more fruits and vegetables, but also the ways in which the clients themselves see it as positive in being able to access the healthy food and being able to have the type of diet that they would want for themselves and their families. There is a desire for more educational materials, nutrition ed, health education, and maybe even more broadly, for a variety of wraparound services to this end. So from my perspective, I would see a need to try and expand this. So for our agency partners out there, I think that there will be work from us to try and expand that type of programming as we move forward. And I can see that education is going to become kind of a more vital part of the program as we move into the next stage. So that's the material I have. I thank all of you for attending. I thank you for your insightful looks at this. And so at this time, we'd invite you to share any questions, comments, concerns that you might have, and we'd love to respond.
Joseph, we have a question. What type of paperwork is required at a mobile food pantry? What info is gathered from clients? And I don't know, maybe Shay wants to answer that question.
Sure, I can answer that one. The information that we collect at a mobile food pantry, just a standard traditional one that is required, is the information that's gathered on the USDA sign-in sheet. So from clients specifically, we're asking that they give us their name, zip code, address, phone number, and then we ask some questions about the demographics of their family. So how many individuals are in your household? So if I use my household, for example, I would say 3. How many of them are seniors? In my household, that would be 0. How many of them are children? In my household, that would be 1. And is anyone in the house identifying as a veteran? Those statistics, is what we call them, are highly important for the food bank for lots of reasons. Part of it goes to a lot of the information that we're talking about here, how many people we're serving, but it also gives us a snapshot look at if we are meeting the need of that community. It helps us send the appropriate amount of food, the right volume. If the truck is kind of designed to serve 100 families and we're only serving 50 on an average at that site, why are we only serving 50? Is there something we can do to maybe increase attendance? Or is this need in this area going down and maybe we should look to a different type of strategy? So we try to keep that information as simple as possible because we know how difficult it is and for people to feel safe to share that information with us. The information is always kept confidential. It is not shared with any other sources. And I do mean no other sources. We don't share that with the health department. We don't share that information with any government entity. It is kept confidential for 3 years plus the current year, and then all records are shredded at that time.
I don't see any other questions.
I see that Gloria has her hand up. I'm curious, Gloria, do you have a question? You can type it in the chat or the Q&A.
She says it was an accident.
It's quite all right. Just didn't want to miss you if there was a question. What other questions do we have out there?
We have one.
Thank you for coming, Sarah. I very much appreciate your attendance today.
Dorothy asks, are the food trucks refrigerated?
Probably another one for me. Yes, over the last probably 18 months to 2 years, you will, for those of you who've been partners with us a long time, have noticed that we are slowly upgrading our fleet of trucks. Having safe refrigerated vehicles to bring to you is also important to help keep the food protected, to make it the best quality that we possibly can, to help it with its shelf life and to continue. So yes, largely the trucks are refrigerated. We do still have several units on rotation that are not refrigerated. And the reason that we still maintain those vehicles is because 2 of them are specifically for distributions that happen in non-paved parking lots. At some point, those vehicles will become obsolete, and this very few sites that do receive those are going to have to look for alternative locations, but there's not a timeline on that at this time. So yes, largely refrigerated, but there are several units that aren't, and they are used sparingly for specific reasons. As we start to move into the summer months, you will also start to see freezer blankets covering cold product like your dairy items, like your proteins, on the truck to help protect them from heat when they come off the truck.
We have another question that I'll direct at Shay again. Are we now requiring a signature on the registration sheet?
We are not requiring signatures on the signage sheet at this time. The USDA has made an allowance for that so that clients do not have to sign their name on the registration form. About 2 weeks ago, an email went out to all agencies, whether you are a mobile food pantry agency or a fixed site or a backpack, with the most up-to-date USDA sign-in sheet attached to it. If you are a mobile pantry partner, you will receive the most up-to-date sign-in sheet attached to every menu that we send to you to make sure that you have the most accurate one. And you'll notice there that the signature line has been completely removed. That is a response to COVID, to not having pens and papers passed back and forth through the window of the vehicle or in person to help limit contact. So no. At this time, signatures are still being waived, and they have not given us a timeline as to when or if that will return.
I've got a couple other questions. Andrew asks, are the results of the focus group available broken out by region or county?
Andy, I'll take that one. And the answer is no. The focus group information was, the focus groups themselves weren't organized around region or county. They were organized essentially based on availability to attend. One of the focus groups was held in Spanish, so that one tended more towards kind of the urban Grand Rapids metropolitan area, but the others were a mix of sites. With some questions focusing on kind of the rural and urban divide, but there was not a whole lot of variation there as well. And so the kind of the uniformity of response across the set held regardless of the location of the members of the focus group.
Another question, how is site-specific feedback shared with grantees or local volunteer organizations? Anyone want to answer that one?
Daniel, I would say that it's not. The site specific, the 30 sites that were involved were selected for their representative nature to the full set. The individual site data itself doesn't really wasn't built for the statistical significance to the site, and so. But again, the numbers are really speaking to that overall piece. And Molly, you want to read Dan's other question?
Yep, he has a follow-up. Do you have any numbers or insight as to whether we are reaching the working poor or ALICE population, or do you have any sites that have implemented any practices to ensure those who work during the day have access to food?
Okay, I'll take the first part and I'll give the second part to Shay. Okay. In terms of reaching the working poor and the ALICE populations, these numbers ran a little high when it came to poverty. That has in part to do how we determined the poverty rates of the folks in this sample group. It was based upon their reporting of monthly income. Now, obviously, there's going to be a percentage of that population where the reason they are attending is because their monthly income has declined. So the 70% estimate that we have on the number of people who qualify as poor that filled out this survey. I would suggest that that figure is probably a little bit high because the month that we were asking them about in terms of income might be depressed a little bit. And on the same token, we're also suspecting that there might be an undersampling of people who fell into an ALICE population, in part because of the time required to complete the survey. And so the survey respondents did run a bit older than we might have suspected. And we're also curious about the ways in which, a single mother with 3 kids may not have had the time to complete everything involved here. So in terms of whether or not we're reaching this population, I think the suggestion, the kind of the differences between our estimates around the number of poor and the number of food insecure suggests that yes, that population is being reached. But in terms of our particular efforts to kind of create access for these populations, I'll let Shay speak to that.
Sure, I can mention a few things about that. One of the biggest ways that we try to reach the folks that do work during the day is by having a large amount of our distributions occurring in the afternoon and the evening. The bulk of our distributions, the most popular time slot used to be 5:30 start time. I would say that that's skewed a little bit earlier now, and it's probably closer to the 4:30 time slot, which can make it a challenge for those that don't get out of work until 5 o'clock. But the volume of those distributions in most communities has also increased. So that gives people the opportunity to kind of hit those distributions on their way home from work, which is ideal. Another way that we kind of try to deal with or address that particular problem is by having the distributions occurring at our schools. When parents are coming to pick kids up from school, from after school activities, a lot of the school sites arrange their distributions to be long after pickup, so that families can come and access as a group, which has been very helpful, especially for people who have a childcare barrier, for families who maybe don't have someone to sit with their young ones in the evening to go out and get food assistance. They can bring the kids to the school because it's a natural fit for them to be there. So. You're welcome.
Another question from Kay. Could you give details of the backpack program? A little bit unrelated, but.
Do you want me to take that one, Joseph?
Yeah.
Okay. So backpack programs differ quite a bit in what they're geared to do, how they're functioning, how they run, how they're set up than the mobile food pantries. Mobile food pantries are kind of designed to meet the family need, where backpack programs are kind of designed to meet an immediate child need. Different communities sponsor backpack programs by basically doing exactly what it sounds like, providing a backpack with excess food in it for kids to take home. A lot of those programs are administered directly through the schools with some type of a partnership between another community partner and the school, or a faith-based organization largely. The largest one I can think of at this time is Hand to Hand. Hand to Hand takes a local church, they partner with a local school, and the Hand to Hand organization and the church is the one packing the backpacks, paying for the food, sourcing it, delivering it to the school, and then the school helps identify the children that are most in need. Backpack programs usually have a very small reach. They can be great for smaller buildings or for targeted populations of high pockets of need, but they do have a smaller reach than the mobile food pantry program does because it targets specific kids and not necessarily a community or family as a whole. And if you have more questions about backpacks, or that's something that you're interested in, I'm sure that there will be a part at the very end where we share all our contact information so you know who to reach for that. So the follow-up question, it looks like, is that do we supply food for backpacks? Yes, we do on a top-down level. We do supply food for backpack programs, but we do not administer the backpack program ourselves here in-house. And what I mean by that distinction, is that those local groups like Hand to Hand do get food from the food bank to put into the backpacks. But Feeding America West Michigan does not have a backpack program in-house where we source the food, we pack them, we deliver them on a client-based level. You're welcome.
I don't see any other questions at this time. Might be all set.
Well, thank you everyone for joining us. We really appreciate your time and commitment to addressing hunger relief for our neighbors in need.